How can you avoid misinterpreting CF infection symptoms? To avoid misinterpreting infection symptoms in cystic fibrosis, it is crucial to understand the nature of cystic fibrosis and its symptoms. Many symptoms can overlap with those of lung infections, but they can also stem from non-infectious factors related to cystic fibrosis itself. Careful monitoring, awareness of your usual health status, and timely consultation with healthcare professionals are essential steps. First, recognize that cystic fibrosis leads to thick, sticky mucus in the lungs. This can cause chronic respiratory symptoms like a persistent cough, wheezing, shortness of breath, and frequent sinus infections. These symptoms can naturally fluctuate due to the underlying disease process and are not always indicative of a new infection. For instance, a chronic cough-producing mucus is common in cystic fibrosis, even when there is no infection present. Second, pay attention to changes from your usual symptoms. New or worsening symptoms such as increased coughing, changes in mucus color or volume, fever, increased shortness of breath, or fatigue may suggest an infection. However, symptoms like wheezing or nasal congestion can also arise from inflammation or non-infectious causes, so it is important to interpret them in context. Third, utilize objective measures whenever possible. Regular lung function tests, such as spirometry, can help detect declines in respiratory status that may indicate an infection. Monitoring your weight, appetite, and energy levels can also assist in identifying health changes. While sweat chloride tests and other diagnostic tools are not used specifically for infection detection, they are important for overall cystic fibrosis management. Fourth, maintain routine infection surveillance as recommended by your cystic fibrosis care team. This may include sputum cultures or throat swabs to identify bacterial or fungal pathogens, which can guide appropriate antibiotic treatment. Relying solely on symptoms for self-diagnosis can be misleading, as cystic fibrosis lung disease often involves chronic colonization by bacteria that may not always lead to acute infections. Fifth, do not assume that all symptoms are due to infection. Some symptoms, such as digestive issues like constipation or bloating, or systemic signs like weight loss and fatigue, may be related to cystic fibrosis complications rather than an infection. Distinguishing these requires a clinical evaluation. Finally, always seek personalized medical advice from cystic fibrosis specialists or healthcare providers when your symptoms change or worsen. They can differentiate between infection and other causes through clinical assessment, diagnostic tests, and their knowledge of your medical history. Prompt and accurate diagnosis is vital to avoid unnecessary treatments or delays in care. In summary, avoiding misinterpretation of cystic fibrosis infection symptoms involves understanding your baseline symptoms, recognizing meaningful changes, using clinical monitoring tools, following infection surveillance protocols, and consulting healthcare professionals for accurate diagnosis and management. This approach helps ensure timely treatment of infections while minimizing confusion with non-infectious cystic fibrosis symptoms.